what we're gonna do is just bring him. I'm gonna stand here so we come up with a plan for every dog, right? Doors and being indoors in a closed area is gonna trigger him a bit with a stranger. So I'm just gonna stand out here. I'm gonna point him this way and I'm gonna shoot him in the boot top with a little sedative. So he'll night give it. He tends to get anxious really easily. So you come up with a little plan to make things as stress-free as possible for him. Stop. Drink over there. So that shaking off, you know, he tends to do that when he gets up and about and moving a little bit, but that's, you know, just kind of, he's got his brain engaged. I always say they're working. So Cole, you have to really have a very good rapport with, and so he and I love each other. Even though he loves me every now and then, if he really doesn't want to do something is when you get pushed back from him, and then he's all teeth. And I have to be very positive in my feelings. We're gonna get clean teeth. Good stuff, you'll feel better. He's an old man now.
Right.
Yeah.
Is that your smallest needle? I did it! I took the Lindbergh, baby! I am Joseph Mingala!
That's it.
So for that, the most important part there is the plan, right? We got to talk about what we're doing. So many owners will bring in a dog who's nervous and just say, here you go, and the plan's already ruined. So making the plan like Angie did there, tell me what we're gonna do, we'll talk about it. As an owner, you're usually relying on the vet to make the plan, right? And that's great. We've done this a bunch of times. So really just communicate first, and then for a vet, when you have a dog who's nervous, the best thing I can have is somebody who's very comfortable holding that dog, right? In 99% of the case, that's not the owner. Sometimes it is. Sometimes we know that you can do a better job than we can. This is a case where we were very calm, very relaxed, all three of us, and it went very well. So that injection's been given. Now it's going to take a few minutes to just relax, okay? In this situation, it would make probably 50% of our vet visits so much better with nervous dogs if we can do this and just give them a little sedation. The dog's calmer, the owner's calmer, and the vet's calmer, and we can do a better job. This particular injection takes about 4 or 5 minutes before he really gets drunk enough for us to handle him.
You'll start to see him wobble already. I know.
Yeah, I can see both, for
He
sure.
doesn't really have a lot of melanoma traits per se, except for a little bit of attitude and feisty.
He's definitely
We're gonna lean on
getting
him.
there. Yeah, and while he's falling asleep, it's important we just keep him from hurting himself while he's stumbling around.
A few moments later.
Yep.
All right, thank you guys. We'll
Yep,
text
yep.
him when we're ready for number 2.
All right.
So we're intubating. This is where you protect the airway. Because during a dental, we're cleaning the teeth with water included. And because we're sedated, we don't want that water going down the trachea. So the intubation is protecting the airway, literally just so we can clean the teeth and fluids don't go the wrong way. A lot of people ask me, can't you just clean the teeth without sedation? And the answer is not well. That is basically the same as you at home just trying to use your fingernail and flick off tartar. That's not doing anything. So to do it right, you have to do it right. Now, your average vet does not do a lot of endodontics or orthodontics. We don't do a lot of caps, and we don't do a lot of root canals. However, if we see a tooth that is bad, we will discuss removing a tooth with you. And so a tooth extraction is relatively common. And in general cases, we're going to remove its teeth if we think it's causing a problem now, or if it's going to cause a problem in the near future, so you don't have to do this again sooner than you need to. So at the end of a dental, those dogs that have been getting the medicine into the muscle a little bit slower to wake up, which is not a terrible thing, because those dogs that receive that injection in the muscle are usually the dogs that are a little bit more frantic, and we want them to wake up a little bit smoother, a little bit slower. And because he's sedated, this is a good time for me to do a good checkup. He's one that would be difficult for me to really feel his belly, really listen to his chest while he's awake. Even with Angie holding him, it would be hard to feel everything. Okay. So you notice me touching his eyes. The blink is both a reflex and a response. It becomes more intense when we're awake. But most of us know that a blink is a little bit of a reflex. If something's swimming in your eye, you're gonna blink. But we actually call it a response because you can't do it while you're anesthetized. And so it is a response. And as he's starting to wake, we'll notice more response around the eyes. His eyes are starting to come forward. They were rolled down. When they're rolled down, that's a perfect plane of anesthesia. That's where we wanted him. But now they're starting to come forward. So he's just showing little signs of waking up. After a few minutes of just oxygen, we will actually remove the oxygen. Sometimes breathing in that oxygen is very nice and actually keeps them relaxed. It's a safety measure at first, but then it almost becomes a crutch. So here in a second, we're just going to remove the oxygen flowing and still let him wake up, just breathing the room air through his tube. And if they're slow to wake up, we will stimulate them a little bit like they would in a hospital if you're waking up from anesthesia. We would give them some pats. We would start talking to him, kind of wake him up a little bit, make him realize that he's been sleeping, and kind of wake him up from a nice sleep. There's a little balloon on these tubes. That balloon inflates when it's intubated to make sure we get a nice seal inside the trachea to prevent that water from going through. So as we're now, everything's good, we're not putting any more water, we deflate that tube because we're getting ready to pull that tube once he shows us he's ready. Guys, sometimes just the act of moving them will also help him wake up a little bit. So we're going to move him into his recovery cage. Oh, there he goes. He's starting. Okay. He started to hop up there. I think he's getting close. So now we've extubated, and now we're just in a cage. So in a vet clinic, this will be just like it is. We're in a cage now, and we're watching every few minutes, making sure that we're still happy with the rate of recovery, that we're breathing well, that we're becoming more and more alert. That injection was given in the muscles, so this recovery is going to be slower. Whereas a lot of the injectable medicines for anesthesia, they come out and they're awake within 20 minutes, but they're drunk for a couple hours. So that's why when your vet says, hey, we need a couple, 3 hours to wake up, that drunken phase is kind of funny, and we want to be there for that just to keep them comfy and happy. So we're in that recovery phase now, and so we'll just be checking every couple minutes, making sure we got a nice breathing rate, and that we're becoming more and more aware of our surroundings.